Anti-aging tips, Botox alternatives for hyperpigmentation, saggy skin, fine lines, and wrinkles. So if you guys are looking for Botox alternatives to addressing fine lines and wrinkles, that is what we're going to be talking about today. Hi, my name is Christy, and I've been treating clients for over 12 years, or about 12 years, treating them with acne, hyperpigmentation, and anti-aging and all other skin conditions. Today it's a little bit discombobulated. My hair is frizzy. We're literally trying to do this before my client comes in. So if you watch the video and you start to see different shading and light, it's because it's literally happening in between appointments. This ending of the year gets really crazy for me, so I will be hopeful to get this video out on time to you folks. So the treatment we're going to be talking about is actually a non-invasive treatment to address things not only like hyperpigmentation, fine lines and wrinkles, saggy skin, dark circles around the eyes, and even acne. It actually helps reduce the amount of bacteria that is on your skin that causes acne. So we have a client here, and so we're using the microcurrent for acne, to treat acne. So how this works with acne is that actually, because it increases skin cell turnover rate, it increases the ATP in the cells, what it's doing is help the existing acne lesions heal faster. It also reduces the amount of the bacteria that causes the acne on here. So it speeds healing and it reduces acne on here. So in this treatment, we're not going to be doing a lot of pinch and hold. We are basically just kind of going to go over, and it helps infuse products as well. So I'm checking the conductivity bar, and we are getting a little bit of electricity, and we're just putting it over the areas where she has breakouts. Now, if the client has more flesh-colored bumps, then how this is going to help with product penetration is using an acid peel such as a lactic acid or glycolic acid peel, and that will help increase the skin cell turnover rate, thus reducing the amount of congestion they have on the face. So with that, you do have to use an additional acid product. But with this area, you're just kind of going over the areas that she has active breakouts. So instead of going around the eyes like the other treatments, we're basically focusing again on the areas where she has active breakouts. And you can use this in an acne treatment, or they can just come in if they want to speed up the healing of the acne. They can also do a package where they are coming in for weekly treatments to help speed up healing of the acne lesions. It actually does a number of things without invasive procedures like sticking needles in your face. So we're going to be talking about today. And also I will be doing a second part of this video going more into detail, showing clients, and this will be more geared towards estheticians. So if you are a licensed professional, plastic surgeon, dermatologist, and you're also looking into microcurrent to basically broaden your scope of practice, then that may be the video for you. But for today, we're going to be talking about the benefits of a microcurrent. Also, I have also got some questions saying, can you use this while you're doing Botox, or you're on Botox and you want to wean yourself off of Botox, and if you are a likely candidate for that. So we're going to be talking about, first of all, people who are not good candidates for this, so that if you fall under this category and you don't want to watch the video, you can jump to something else. Okay, so here are the factors of which you are not a good candidate. So one of them is obviously if you have a heart condition, or if you've had recent heart surgery, if you've had recent facial surgery, meaning the lesions or whatever that you have haven't completely healed yet, if you are under the age of 18, if you're pregnant, if you're breastfeeding, if you're currently using Retin-A, you have to discontinue use of that for at least several weeks before you can start this treatment, because your skin can be sensitized to this because it actually increases product infusion and penetration. So if you're using Retin-A, you have to kind of wean off that before you can start the microcurrent. Other conditions include diabetes, epilepsy, or other heart conditions. If you've also have an active form of cancer, meaning you have, you're doing radiation, you're undergoing radiation right now, you're undergoing chemotherapy, you are also not a good candidate for this at this time. Because microcurrent is exactly that, using very, very small currents of electricity going through your body, having a pacemaker you're also not a likely candidate, or any other metal implants near or around the face. You can also use this in conjunction with other types of therapy as well to actually increase the efficacies of this, such as LED lights, microdermabrasion, cryotherapy, acid peels, any of those types of things. You can use most of that. I will go more into detail on the second one because that is more towards linked to professionals, because when you as a client go in to see a professional, you don't really need to know what it can be used as, because they're already going to know. Okay, so how this works is, unlike the muscles in your body that are typically connected to bone and tendon, the muscles in your face are actually connected to bone and skin, and so you've got about 32 muscles that can cause micro expressions, all these different expressions on your face. And so when you're doing an expression over and over and over again, they can form creases or wrinkles in the skin. And so some of the examples are the number 11 lines in between the brows, obviously fine lines and wrinkles, crow's feet, the marionette lines, sagging of the skin, and sometimes they call this a turkey neck, but sagging skin right underneath the neck. So sometimes what happens is, as we age and the collagen and elastin starts to break down, and the repetitive expressions that we do over time along with that can form deeper and deeper creases along your face, whether it's around your lips, whether it's smile lines, frown lines. What Botox does is it actually freezes the muscle, preventing you from making that expression. So when you don't make that expression using your muscle, then of course, because your skin is attached to that muscle, it stops making that particular wrinkle or crease. What microcurrent does, it actually does the opposite. So think of a gym. It actually works out the muscles. It increases the energy resource, or the ATP, in your cells, regenerating it and actually creating more new cells, stimulating your collagen and elastin and fibroblasts. So typically when somebody gets this done, it is very common for people to feel a tightness in their skin because you've basically worked it out. So after working out at the gym and your muscles feel tighter, it's because you worked out that muscle. So it's the same thing that microcurrent does, except it uses very, very small amps of electricity to stimulate those muscles. So the microcurrent machine can help strengthen and relax overused muscles. So some of the overused muscles can be the corrugator right here, superciliary muscle, which actually helps bring so when you're squinting, or when they're called the frown lines, you get the number 11 lines. It keeps pulling your eyebrow in more. So it can address lines that go across your forehead, the number 11 lines, the creases or the fine lines and wrinkles, crow's feet around your eyes. It can actually help address what's called bunny lines, which are lines down your nose, as well as the creases right along your upper lip, as well as creases along your chin, and marionette lines, and the sagging of the skin that's around the jawline, including your neck. Okay, so how microcurrent works within the skin is it actually helps restore, by using the amps, it helps restore the ATP within the cells. And ATP, which stands for adenosine triphosphate, it basically helps restore the energy within each of the cells, which then can help with the restoration and the healing process of the skin. So for example, it can actually stimulate fibroblast activity up to 60%, and fibroblast activity is basically collagen synthesis and elastin. It can actually help increase the ATP in each of the cells with up to 600%. Okay, so here are a few statistics for you. It helps increase membrane transport, cell permeability by 30 to 40%, and protein synthesis up to 73%. So some of the benefits of microcurrent is, for example, some of the superficials that you can see almost immediately is it reduces the pore size and constriction. It also reduces the visibility of sun damage and hyperpigmentation. The internal parts of it that you see much later in the treatment is it helps, as I mentioned before, it stimulates collagen and elastin production. So what that does, it actually starts to make the skin look firmer. It actually feels firmer, and I can show you some other footage on that later on actual clients. It actually tightens the collagen and elastin matrix deep within the dermal layers. So what happens as a result of that is your skin starts to actually be tightened, and the sagginess around the jaw lines usually start to tighten as well as any loose muscles in the neck and loose skin, because remember, the skin is attached to the facial muscles. It also reduces edema or swelling. So if someone tends to have, kind of the puffiness around the eyes here, or under the eyes and over the eyes, you can actually start to tighten, and it helps with lymph drainage when you do it a lot more gently. So there's a whole array of things that can happen, and over time it just increases moisture retention as well. So I will show you in some of my clients, when I begin the treatment, I apply the gel on. Several times I have to reapply the gel and keep spraying hydrating toner, the mist on there. As we progress in the treatment, you will also see that I will have to do less reapplication of the gel because their skin can retain that moisture. So if you are finding this information helpful, whether you are a potential client for someone, you're looking into this as a way of helping with your anti-aging and you're looking for Botox alternatives, or you are a licensed professional, which we have a lot of licensed professionals watching our videos, so thanks for your viewership, and you haven't subscribed, please go ahead and hit that subscribe button. Go ahead and give us a like, telling us that you like these type of videos where I'm showing more of my clients and what we're doing within the treatment room. And if you like product reviews as well as ingredients breakdowns, please make sure to subscribe. And if you know someone that might be interested, please make sure that you share this video. So the first client I'm going to show you is Fatima, and Fatima is in her mid-20s, and she's been coming to me about 7 to 8 years, so she's actually started very early in her skincare. And her challenge was she started to develop the number 11 lines in between her brows, as well as some darkening of around her dark circles around her eyes. And so you're going to see in this treatment where she started and how the number 11 lines started to become more minimized and finer, so you could barely tell that she had them. The next client I have up here is Jessica. She is actually 40 years old, and I got permission from all of my clients to use their name and their age. She has more visible signs of sun damage. She has uneven skin tone, hyperpigmentation, she has fine lines and wrinkles, and so we used her because she had the most visible change, and she also did the full 10 treatments. We would have recommended that she kept going because she could have, but since I'm no longer be able to do them, which will be in another video, basically you will see that she started to form these vertical lines among her forehead, as well as the horizontal lines across her forehead, and she had hyperpigmentation around her mouth, and you will see the brightening over time. So we're going to show the photo progression because we took pictures before and after, as well as her neck. She had some sagginess in her neck, and it really started to firm up underneath her neck. And then our final client is Rosie, and she is in her 50s, and she has really, really good skin. She follows my protocol, so her skin looks great. She is 56, I think it is, and so she only did 5 treatments. So she didn't even do the minimum amount. You have to remember that the minimum is 10 to start seeing actual, like, noticeable results. But here's a picture of her in this treatment. I don't know how much we can zoom in, but the small noticeable results that we did start to see is the fine lines around her eyes and around her mouth did start to soften. Now, if you are a licensed professional and you are watching this video, I am going to include a link to the website that you can get more information on that. And I actually recently received an email from the company that gave me this machine that they're going to send me a link so you can get a certain percentage discount on the machines. I'm not gonna, oh, hi. Okay, so as you can see, I literally do these in between appointments. Even if we sometimes have just 15 minutes, we just like put the light on and start filming. So that is why I don't look glamorous, because I'm still working. Anyway, okay, so back to what I was saying is that for those of you who are licensed professionals, if you go into, this is an affiliate link. So if you click on it and you're a licensed professional and you want to purchase the machine, you get a 5% discount code and free shipping, I think it is, over $200. What I get back is 10% of whatever you chose to buy, whether it's accessories or machines, and if you don't buy it, no big deal. So just wanted to let you know, full disclosure. And the link will be in my description below. But I will give more information on this actual machine in the following video for you. But if you're already interested in that, I will include the link below. And please note, this is only for licensed professionals only. This is not for the regular consumer. Sorry, guys. Now, this machine actually can be used in conjunction with other treatments such as LED, microdermabrasion, acid peels, a whole array of things which will be in the next video. And there's actually 2 accessories that come with it where you can actually attach, where you can focus only on the eye area as well as only on the lip area, and then the 2 probes that you can actually, you yourself can specifically maneuver and manage to do the pinch and hold maneuver versus the glide and slide maneuver. So remember, makeup is an art and skincare is a science. Thanks for watching.